Are you curious about the uses, benefits, side effects, dosage, and risks associated with the medication called metronidazole? In this comprehensive video, we will dive into all the essential information you need to know about this widely prescribed drug. Common uses of metronidazole. Metronidazole is a versatile medication that is used to treat a variety of bacterial and parasitic infections. It has been a go-to choice for healthcare professionals for many years due to its effectiveness in fighting off certain types of infections. Let's take a closer look at some of the common uses of metronidazole. Bacterial vaginosis. Bacterial vaginosis is a common vaginal infection caused by an imbalance of bacteria in the vagina. Metronidazole is often prescribed to treat this condition, as it has been shown to effectively eliminate the harmful bacteria and restore balance. Pelvic inflammatory disease. Pelvic inflammatory disease, PID, is an infection of the female reproductive organs, usually caused by sexually transmitted bacteria. Metronidazole is frequently used in combination with other antibiotics to treat PID, as it helps to combat the infection and reduce inflammation. Gastrointestinal infections. Metronidazole is also effective in treating certain types of gastrointestinal infections, such as Amebiasis and giardiasis. These infections can cause symptoms like diarrhea, abdominal pain, and cramping. By targeting the specific bacteria or parasites responsible for these infections, metronidazole helps to alleviate symptoms and promote healing. Dental and gum infections. In addition to its uses in treating vaginal and gastrointestinal infections, metronidazole is also commonly prescribed for certain types of dental and gum infections. These infections can cause pain, swelling, and inflammation in the mouth. Metronidazole works by eliminating the bacteria responsible for these infections, helping to alleviate symptoms and promote healing. Overall, metronidazole is a versatile medication that is used to treat a wide range of bacterial and parasitic infections. It is important to note that this medication should only be used under the guidance and supervision of a healthcare professional. Benefits of metronidazole. Metronidazole offers several benefits when used to treat various infections. Let's explore some of the advantages of using this medication. Effective against specific bacteria and parasites. Metronidazole is known for its effectiveness against certain types of bacteria and parasites. It specifically targets the DNA of these microorganisms, disrupting their ability to reproduce and spread. This makes it an excellent choice for infections caused by these specific pathogens. Wide range of applications. Metronidazole can be used to treat different types of infections, making it a versatile medication. Whether it's a vaginal infection, gastrointestinal infection, or dental and gum infection, metronidazole can often provide relief and promote healing. Well tolerated for most people. In general, metronidazole is well tolerated by most individuals. While there may be some side effects, which we will discuss later, they are typically mild and temporary. This means that many people can benefit from the medication without experiencing significant discomfort or adverse reactions. Cost-effective. Metronidazole is a relatively affordable medication, making it accessible to a wide range of individuals who may need treatment for the infections it targets. This can be particularly beneficial for those without insurance coverage or limited financial resources. While metronidazole offers significant benefits in treating infections, it is essential to be aware of the potential side effects and risks associated with its use. From common side effects like nausea and diarrhea to more severe risks such as allergic reactions and nerve damage, we will discuss all the potential implications of using this medication. Metronidazole side effects. Like any medication, metronidazole can cause side effects in some individuals. It's important to be aware of these potential side effects so that you can recognize them if they occur and seek medical attention if necessary. Here are some of the common side effects associated with metronidazole. Nausea and vomiting. One of the most common side effects of metronidazole is nausea, which may be accompanied by vomiting. These symptoms are usually mild and improve over time. Taking the medication with food can help reduce the likelihood of experiencing these side effects. Diarrhea. Metronidazole can cause diarrhea in some individuals. This side effect is typically mild and resolves on its own. Staying hydrated and consuming foods that are gentle on the digestive system can help alleviate diarrhea symptoms. Metallic taste. Some people may experience a metallic taste in their mouth while taking metronidazole. This side effect is usually temporary and goes away once the medication is discontinued. Allergic reactions. Although rare, allergic reactions to metronidazole can occur. Signs of an allergic reaction may include rash, itching, swelling, dizziness, or difficulty breathing. If you experience any of these symptoms, seek medical attention immediately. Nerve damage. In rare cases, prolonged or high-dose use of metronidazole can lead to nerve damage. This may cause symptoms such as numbness, tingling, or weakness in the extremities. If you experience any unusual neurological symptoms while taking metronidazole, consult your healthcare provider. It's important to note that the side effects mentioned above are not exhaustive, and individuals may experience different reactions to the medication. If you have any concerns or questions about the side effects of metronidazole, it is best to consult your healthcare provider. Recommended dosage of metronidazole. The dosage of metronidazole prescribed by your healthcare provider will depend on several factors, including the specific infection being treated, your age, weight, and overall health. It is essential to follow your healthcare provider's instructions and take the medication as directed. Here are some general guidelines for the dosage of metronidazole. Bacterial vaginosis. For the treatment of bacterial vaginosis, metronidazole is often prescribed as a one-time dose of 2 grams. Alternatively, it may be prescribed as a lower dose taken twice daily for 7 days. Pelvic inflammatory disease. When treating pelvic inflammatory disease, metronidazole is commonly prescribed in combination with other antibiotics. The dosage and duration of treatment will vary depending on the severity of the infection and other individual factors. Gastrointestinal infections. The dosage of metronidazole for gastrointestinal infections will depend on the specific infection being treated. It is typically taken orally, and the duration of treatment can range from a few days to a couple of weeks. Dental and gum infections. Metronidazole is often prescribed in combination with other antibiotics for the treatment of dental and gum infections. The dosage and duration of treatment will be determined by your dentist or healthcare provider. It's crucial to complete the full course of treatment prescribed by your healthcare provider, even if your symptoms improve before the medication is finished. This helps to ensure that the infection is fully eradicated and reduces the risk of antibiotic resistance. Risks and precautions when taking metronidazole. While metronidazole is generally safe and well tolerated, there are certain risks and precautions to be aware of when taking this medication. Here are some important considerations. Alcohol and metronidazole. It is essential to avoid consuming alcohol while taking metronidazole and for at least 48 hours after completing the course of treatment. Combining alcohol with metronidazole can cause severe nausea, vomiting, abdominal cramps, and headaches. Pregnancy and breastfeeding. If you are pregnant or breastfeeding, it is crucial to inform your healthcare provider before starting metronidazole. While the medication is generally considered safe during pregnancy and breastfeeding, it is best to consult with your healthcare provider to weigh the risks and benefits. Liver disease. Metronidazole is primarily metabolized by the liver, so individuals with liver disease may require a lower dosage or alternative treatment. If you have a history of liver disease or any liver conditions, it is important to disclose this information to your healthcare provider. Drug interactions. Metronidazole may interact with certain medications, including blood thinners, lithium, and certain antifungal medications. It is crucial to inform your healthcare provider about all the medications and supplements you are taking to avoid potential interactions. Allergies and sensitivities. If you have a known allergy or sensitivity to metronidazole or any other medications, it is important to inform your healthcare provider. They can determine if metronidazole is safe for you or recommend an alternative treatment option. As with any medication, it is essential to follow your healthcare provider's instructions and disclose any relevant medical information to ensure the safe and effective use of metronidazole. Alternatives to metronidazole. In some cases, metronidazole may not be suitable or effective for certain individuals or infections. Fortunately, there are alternative treatment options available. Your healthcare provider will determine the most appropriate course of action based on your specific needs and the nature of the infection being treated. Here are some common alternatives to metronidazole. Clindamycin. Clindamycin is an antibiotic that can be used as an alternative to metronidazole for certain infections. It works by inhibiting bacterial growth and is often used to treat bacterial vaginosis and dental infections. Tinidazole. Tinidazole is another medication used to treat certain infections, including bacterial vaginosis and giardiasis. It is similar to metronidazole in its mechanism of action and effectiveness. Antibiotic combinations. In some cases, your healthcare provider may prescribe a combination of antibiotics to treat your infection. This may involve using metronidazole in conjunction with another antibiotic to maximize effectiveness. It is important to remember that the choice of alternative treatment will depend on various factors, including the specific infection being treated and individual patient factors. Your healthcare provider will consider these factors and recommend the most appropriate treatment option for you. Metronidazole and its interaction with other medications. Metronidazole has the potential to interact with certain medications, which can affect their effectiveness or increase the risk of side effects. It is crucial to inform your healthcare provider about all the medications and supplements you are taking to avoid potential interactions. Here are some examples of medications that may interact with metronidazole. Blood thinners. Metronidazole may increase the effects of blood thinners, such as warfarin. This can increase the risk of bleeding. Your healthcare provider may need to adjust the dosage of your blood thinner or monitor your blood clotting levels more closely if you are taking metronidazole. Lithium. Metronidazole can increase the levels of lithium in the body, potentially leading to lithium toxicity. If you are taking lithium, your healthcare provider may need to adjust your dosage or monitor your lithium levels more closely. Antifungal medications. Certain antifungal medications, such as fluconazole, may interact with metronidazole. This can affect the levels of both medications in the body, potentially leading to increased side effects or reduced effectiveness. It is crucial to provide your healthcare provider with a complete list of all medications, including prescription drugs, over-the-counter medications, and supplements, to ensure safe and effective treatment with metronidazole. How to take metronidazole correctly. To maximize the effectiveness and safety of metronidazole, it is important to take the medication correctly. Here are some guidelines for taking metronidazole. Follow your healthcare provider's instructions. Always follow the dosage and administration instructions provided by your healthcare provider. Take the medication as directed and complete the full course of treatment, even if your symptoms improve before finishing the medication. Take metronidazole with food. Taking metronidazole with food can help reduce the likelihood of experiencing nausea or an upset stomach. If your healthcare provider advises you to take it with food, be sure to do so. Avoid alcohol. As mentioned earlier, it is crucial to avoid consuming alcohol while taking metronidazole and for at least 48 hours after completing the course of treatment. Combining alcohol with metronidazole can cause severe adverse reactions. Store the medication properly. Store metronidazole in a cool, dry place away from direct sunlight. Follow the storage instructions provided by the manufacturer or on the packaging to ensure the medication remains effective. If you have any questions or concerns about how to take metronidazole correctly, do not hesitate to reach out to your healthcare provider or pharmacist for clarification. Conclusion: is metronidazole right for you? Metronidazole is a widely prescribed medication used to treat a variety of bacterial and parasitic infections. It offers several benefits, including its effectiveness against specific pathogens, versatility in treating different infections, and generally good tolerability. However, it is important to be aware of the potential side effects, risks, and precautions associated with its use. Always consult with your healthcare provider to determine if metronidazole is the right choice for your specific condition. They will evaluate your medical history, consider any potential drug interactions, and weigh the risks and benefits to determine the most appropriate treatment option for you. Remember to take metronidazole as directed, complete the full course of treatment, and disclose any relevant medical information to ensure safe and effective use. By being informed and proactive, you can play an active role in your healthcare and make the best decisions for your well-being.